How does your bladder work for urinary health? Imagine a balloon that fills and empties smoothly, helping you stay comfortable and healthy. That's essentially what your bladder does. It's a hollow, stretchy organ located in your lower abdomen, and it plays a vital role in your urinary system. Your kidneys start the process by filtering waste and excess water from your blood, creating urine. This urine then travels down to tubes called ureters and collects in your bladder. The walls of your bladder are made of a special smooth muscle called the detrusor muscle. When your bladder is empty, these muscles are relaxed, allowing the bladder to expand as it fills. Most people can hold between 500 and 700 milliliters of urine, but you usually start to feel the urge to go when it reaches about 200 to 350 milliliters. As your bladder fills, stretch receptors in its walls send signals to your brain, alerting you that it's time to find a bathroom. When you decide to urinate, your brain sends signals back to your bladder. The detrusor muscle contracts, squeezing the urine out, while the muscles around the urethra, the tube that carries urine outside your body, relax. This coordinated effort allows urine to flow out smoothly. In men, the urethra passes through the prostate gland, which is located just below the bladder. Healthy bladder function depends on this precise communication between muscles and nerves. If anything disrupts this system, you might experience issues like urinary incontinence, which is leaking urine, or urinary retention, where you can't fully empty your bladder. Overactive bladder causes frequent, sudden urges to urinate, and infections or bladder stones can also interfere with normal function. From a health perspective, it's important to understand that the lining of your bladder is in constant contact with urine, which contains waste products filtered from your blood. Over time, exposure to certain chemicals or chronic irritation can increase the risk of abnormal cell growth, leading to bladder cancer. Symptoms of bladder cancer can include blood in the urine, increased frequency of urination, pain during urination, or feeling the need to urinate without success. However, these symptoms can also be caused by less serious conditions, so seeing a healthcare professional for an accurate diagnosis is essential. To keep your bladder healthy, stay well hydrated, avoid tobacco, which is a major risk factor for bladder cancer, and practice good bathroom habits. If you notice persistent urinary symptoms, don't ignore them. Early detection and treatment can greatly improve outcomes. Regular checkups and prompt medical attention are key to maintaining your urinary health. Remember, everyone's body is different, so personalized advice from a healthcare provider is always best. Protecting your bladder is an important part of overall health, and understanding how it works helps you take better care of it every day.